good evening. I want to welcome you to this special moment. This is Safe to Speak. We open doors to honest conversations, and I want to thank you for joining us tonight. Just a quick one. I'm trying to uh, do a bit of a setup so we don't have technical issues in the course of this discussion. I will try to make it as brief as possible. Okay, I'll try to make it as brief as possible. Tonight we are discussing a topic that affects every one of us all over the world. Now, this is a very sensitive topic and it affects everybody from Africa down to America to Europe, Asia, every part of the world. This topic affects everyone. Now, we want to look at is compassion necessary to be taught, you know, to doctors, surgeons, and the rest. Is compassion, should compassion be taught in healthcare generally? I don't know about you. I've had a couple of experiences where you go to the hospital and the way you are attended to, it's as if they don't no one care about you. You are just considered as one on just another case that have come to the hospital, or another client that have come to the hospital, and then there is no humanity, there's no compassion, there's no love, there's no care. It's a matter of this is just a patient, just another patient. So do you think compassion is something that should be taught in healthcare generally all over the world? Recently, I saw a disturbing video from, I will not mention the name of the country, but certainly in Africa, where a woman just gave birth and then the doctor meted out violence to the woman for who knows what could be the reason, that the doctor was so provoked that the doctor actually slaps, beat up a woman that just gave birth. It brought national outrage in that country and the whole of Africa. There was this outrage, and the doctor was arrested. His license was withdrawn, and he was sentenced to 10 years imprisonment. So, is it his fault, or compassion ought to have been taught? Let that sink in. So I want to hear from you. Basically, I want to hear from you. I want to be able to hear your thoughts on this subject matter. Should compassion be taught in healthcare delivery? Recently, I also Safe to Speak also posted a video where a good Samaritan rushed some accident victims to the hospital. I think this one is I have to mention. I have to mention it's actually my country, Nigeria. Accident victims were rushed to the hospital by a good Samaritan, and they got to the hospital, and no, all the emergency staffs, nobody wants to attend to them. They were asking the good Samaritan to bring the patient out of the car by himself. So what now? And the good Samaritan asks, "What's now your responsibility?" These people, they were involved in an accident. I drove them, brought them to the hospital. They are in front of the emergency ward, and you are asking me to bring them out of the car to the stretcher or to the whatever, before you now roll them into the emergency ward, or roll them into emergency. There was no sense of urgency at all. No sense of urgency. They were there back and forth for over 30 minutes. That's enough time. I believe we are all aware that in healthcare, every second matters, is between life and death. So, but it just treat patient with levity. There was no urgency. There was no compassion for the patient. There was just no humanity. How terrible that was. That could be anyone. That could even be those who were supposed to intervene at that very moment. It could be a family member. It could be you. It could be your brother, your sister. It could be a friend, a colleague. It could be anyone. This can happen to anyone. When sickness, accidents were to happen, no one considers whether you are a surgeon, you are a health practitioner or so. No, it comes and it comes. At that point, you need someone to attend to you. What if the person that ought to attend to you treats you with inhumanely, or treats you without compassion, without love, without urgency? So this is our conversation tonight. I like to hear from you. I like to hear from you. I see Ayodeji Sofoluwe. You are here. You could do a comment, ask questions. You could also make contribution. I will make sure I speak about your comment. Okay. So, ladies and gentlemen, this is safe to speak. We open doors to honest conversation here. And the conversation tonight is, should compassion be taught in healthcare delivery, or healthcare delivery should simply be professional in all ramifications? It should simply, strictly be science, no compassion, no faith. On this channel, we advocate for faith-based healthcare conditions. That's why we promote the activities of Dr. Joe Njagi, uh, endometriosis specialist from Kenya. I think he's at the African Center for Endometriosis, Kenya. We promote his activities. You know why? This is a man with so much compassion and love for his patients. He connects so well with his patients that before every medical procedure, before surgery, he sometimes prays with his patients. He sings with them. He worships God with them. And at that moment, faith is stirred up. Hope is stirred up. At that moment, a patient that hitherto was filled with anxiety becomes relaxed. And such relaxation is absolutely necessary for medical procedure to be successful. So such a moment end up calming nerves and all of that. So should this be taught? Should this be encouraged? From safe to speak perspective, we advocate for faith-based medical delivery where healthcare professionals treat patients with compassion, with love, with understanding, with patience. Because sometimes these healthcare um, workers tend not to be patient, not to have some level of patience. They feel every patient should have this understanding and simply cooperate with them. A situation where a patient is not